Hi and welcome. We're going to talk about health insurance, the Affordable Care Act, better known as Obamacare. In this video, you will learn what are the different four levels in the law, what is covered under Obamacare, the difference between an HMO and a PPO, what are the requirements for getting premium subsidies from the exchange to lower the cost of health insurance so you can afford to purchase a plan. Since it's mandatory to have health insurance, it's important you're familiar with the facts and the penalties for not having health insurance covered in 2016. Open enrollment is on right now for renewing or getting a new policy in compliance with the ACA law, better known as Obamacare. My name is Juan C. Martinez. I'm a licensed agent in Florida, and I wanted to make this video so you can get the facts about the law. I can't stress enough the importance of choosing the right plan based upon your medical needs and budget so you'll be able to afford copays, deductibles, and out-of-pocket expenses. According to the IRS, that's Internal Revenue Service, the fines for not having health insurance coverage are $695 per individual, $347.50 per child under 18 years old, or 2.5% of your annual household income. You will pay whichever amount is higher. So, if you are a U.S. citizen, permanent resident, or live and work in the United States under an approved visa, it's mandatory to have health insurance. The good news is, because of this mandate, the government offers subsidies to help you with your monthly premium payments. If your household income falls under the 400% of the 2016 Federal Poverty Level, FPL, you'll qualify for government subsidies. Also, you may qualify for a cost-sharing reduction. The government pays the insurance company and you pay the difference of the monthly premium. The insurance subsidy takes into account the annual household income and the number of household members. Then it is deducted directly from the premium, and in some cases the monthly premium you pay could be as little as $50 a month, $15 a month, or even zero. There are four levels in the exchange, the health care plan levels. Basically, like I told you, there are four levels: bronze, silver, gold, and platinum. Now, the primary doctor visits are covered under the bronze level, silver, gold, and platinum. The specialists are also covered on the bronze, silver, gold, and platinum plans. Preventive care, screening, and immunizations, they're also covered under all the plans. Diagnostic testing, imaging, also covered. Prescription drugs, also covered in all plans. Emergency room visits, also covered. And other things like maternity and mental illnesses, they're also covered in it. So what is the difference? The plan premiums, copays, and out-of-pocket expenses. And here's where it gets interesting. When it comes to the medical expenses for typically the year, the insurance company in the case of the bronze level pays 60% of all expenses. You pay, therefore, 40% of all expenses. Monthly premiums generally are low, out-of-pocket expenses are high, and this is a good option for healthy people that don't need health care services on a regular basis. In the silver plans, the insurance company pays 70% of all medical expenses. You pay 30%. Monthly premiums are a little higher than in the bronze plans. Out-of-pocket expenses are a little lower. This is a more balanced approach to out-of-pocket expenses with monthly premiums for people who visit the doctor a few times a year, and generally they're in good health. Now, the gold plans, the insurance company pays 80% of the plan. You pay 20% of the plan. Monthly premiums are higher than those in silver plans. Out-of-pocket expenses are lower. This is a good plan for people that need regular checkups or have a mild condition like a high blood pressure. And finally, we have the platinum plans, where the insurance company pays 90% of the plan. You pay 10% of all medical expenses. Monthly premiums are the highest of them all. Out-of-pocket expenses are very low. And this is a plan designed for people who require more health services than or have any conditions that require more visits and care, like a diabetes or other light illness. The Marketplace Financial Assistance Program. Within the Marketplace, under the bronze, silver, gold, and platinum plans, you have the health insurance monthly premium, the government system subsidy payment, and you pay the difference. For instance, let's say that you choose a bronze plan, which the monthly premium is about $100 a month. The government gives you qualify for a subsidy of $100 a month. Well, in this case, you don't pay anything. If you were to choose a silver plan that says it costs $200 a month, the government pays you $100 a month. Directly, the insurance company $100 a month. You then have to pay for that plan $100 a month to the insurance company. If you were to choose a gold plan, which monthly premium could be $300, for instance, and the government system subsidy is $100, you pay $200. Same goes for platinum. A higher premium minus the subsidy, and you pay the difference. The amount of the financial assistance based on the household annual income, and you may qualify if the total family income falls between 0 and 400% of the federal poverty level. Besides the different levels, you also have the different types of networks that provide healthcare services. They are known as HMOs and PPOs. The HMOs are health maintenance organizations. The advantages: patients have a primary care physician who can develop a relationship. They offer low-cost payment and generally no deductibles. It's a good low-cost alternative. Disadvantages: primary care physician acts as a gatekeeper. They restrict the number of hospitals, labs, and other facilities. Auto networks are not covered. Referral needed from your primary care physician to see a specialist. The HMOs generally is a small clinic under typically one roof, where you have your primary care physician, then you have the nurses and other assistants, then you have specialists that work within the same clinic or office building and providing with different healthcare services. Under this umbrella is what is called the HMO network. Under our plans, it's called MyBlue. And we offer free doctor visits in most of our plans. Then you have the PPO, the Preferred Provider Organizations. The advantages: more flexibility when choosing a doctor, coverage for outside the network or services. You don't need a referral to see a specialist, and it's more flexible in your healthcare decisions. Disadvantages: higher copayments than HMOs, higher premiums than HMOs, may be offset by the federal subsidy, and depending on the plan, a slightly higher deductibles. And here are how they work. Remember, we had the HMO MyBlue program that we talked before. Then outside of those, outside of the network, the HMO network, you have a series of clinics, doctors, laboratory services providers, all kinds of health care services providers, hospitals, etc. Within the PPO network, we have close in a circle what is called a PPO network. This network is under our plan is called the Blue Select, and it has about 80% of all medical practitioners, hospitals, etc. in the state of Florida. Then the bigger network under our plan is called the Blue Options, and it takes about 99% of all practitioners in the state of Florida. We have free doctor visits in most of our plans. Remember, if you have health insurance, you must renew it. If you don't have health insurance, you must get it, and it must be done during the open enrollment period. You first must select an HMO or a PPO network. Check that your doctor is in the network so that whenever you go to see him, it is covered. Choose your plan carefully: bronze, silver, gold, platinum. Check the deductibles, copays, and out-of-pocket expenses. If you don't have coverage, you will pay a penalty. If you qualify for subsidy, it will be included in the premium. Going through the process of searching and comparing plans, insurance companies, network takes time and effort. And if you choose wrong, it could be very expensive. You could require services that are not included, or deductibles and copay that are too high for you. That's why we made the whole process a lot easier and faster for you. First, tell us about you. Click on the link below and fill out the short form answering a few basic questions so we can qualify you for the federal subsidy and a plan. 2, review your 3 options. I will send you 3 different plans based on your needs and budget that includes any subsidy of your monthly premium. Select your favorite plan and you're done. Select the plan that you like the best and you're done. After we process your request, you will receive a welcome letter from the insurance company and a plan summary. That's it. Remember, tell us about you, review your options, and select your favorite one. Click the link below, and I'm looking forward to helping you. Thank you.